So today, focus is going to be on hip mobility. You already know who you are. I'm just here to help. So first thing first, I like to go over is the psoas muscle test. Most of you do not know what that is. Psoas muscle starts in the lower lumbar spine, transitions down to the inner thigh. It does two things. Raises the thigh up and brings the torso down. A lot of people have this issue with hiking. Maybe you're sitting too long and all of a sudden have to get up, maybe from long commute or a desk job. Sometimes, actually a lot of times, we'll see it with people doing improperly abdominal workouts. That's why your back is hurting when you're doing your ab crunches or sit-ups or whatever you're doing over there, bro. So, good way to test it if you know that there's some kind of imbalance. All right, actually, first we're gonna start with the test. So I have you sitting. First things first, what you do is you raise one knee. Now, it's better to have someone else do this, but if you're at home by yourself, what you wanna do is just go ahead, push down with a little resistance, and you're gonna push up on the knee. And then if that causes pain, guess what? That's probably the side we need to work on. Try the next side. Go ahead and push up and go against that resistance. If you feel that side has pain, guess what? Another side we have to work on. 9 times out of 10, you're going to see one side over the other. If there is no pain, but you feel that one side is weaker than the other, guess what side we need to work on? The weaker side. So, getting into the stretch. So, first thing we're going to focus on is the psoas stretch. Starting with the left side, we'll have the left leg on top. And what we want to do is have the right foot come in front. Most important scenarios, we want to have hips, shoulders, and knees facing the same direction. It will kind of want to push you into the outer or more so to the right. Try to keep that streamlined. What you're going to do is just get a lunge in there. You're going to feel it more so on the inner thigh. You may feel it in the lower back if it's a little intense. Usually I'll have you go into it, take a deep breath for 3 seconds. 1, 2, 3, then come out of it and do it again. Wash, rinse, repeat. Once you get a couple of those in, we'll switch to the other side. Same thing, knee, engage, knee, posture straight. And just get into the lunge. Focus on breathing. You have to breathe during this stretch. There's no way oxygen could get to that muscle group without breathing. All right. All right. And then moving on to the IT band. And the band goes from the hip joint down to the knee, so you can go through that entire area. And you can rotate a little bit forward and backward to make sure you get all aspects of it. Again, this is not a correction. This is just to ease some of the tension. For correction, you want to see a practitioner. Chiropractor help. Sometimes massage therapists know about this muscle and how to engage and release it. Awesome. And of course, I always recommend you do both sides. It'll be a little sore. You may have some knots here and there. Just try to push through it. Sometimes we can ice it. If the knot is a little too tender, we'll just go above and below it until we work those knots out. All right, then we'll move on into the piriformis. Basically, using the foam roller, we're just going to use it as a glute because it's pretty much embedded around and sometimes in between the glute muscles. The affected side leg will be up and you're just going to rotate back and forth over that muscle to release. And of course, again, both sides. Awesome. Perfect. When we're talking about the IT band, the muscle itself stems from the TFL, tensor fasciae lata, going into the ischial tibial band. The ischial tibial band is just the tendon We can work on it all day, it will release, but eventually we need to work on the muscle. One way to self-assess if the IT band is something that you are dealing with or having some kind of issues with, maybe you can see it yourself, maybe you can have someone else tell you. Normally, when you're in a standing position, your proper stance may show one foot rotated outwards. That's a good sign that you have a lot of tension in the IT band or the TFL. Therefore, we'll go into the stretch. So we just went over hip mobility. This plays a part in all aspects of life. For example, getting in and out of the car, getting in and out of the bed. Maybe you do athletics, maybe you're into hiking, running, maybe you do basketball, gymnastics. This will change your life. If you benefited from it, or maybe know a friend that can, like, comment, share, go ahead and subscribe. More videos to come on a weekly basis.